Menopause is the end of menstruation and fertility and is a normal and natural stage of every woman's life. The UK has an ageing workforce and around 75 to 80% of females of menopausal age are in work, so it's clear that menopause is a health issue of particular importance to employers. Within the health sector, for example, a significant proportion of staff are female. Employers have a responsibility for the health and safety of all staff and must proactively demonstrate their commitment to supporting and managing our age-diverse workforces. Responsible employers want to create an environment where colleagues can talk about it openly and where information is readily available for female staff. This video forms part of a toolkit for managers designed to enable them to appropriately support their staff to remain in employment and manage their symptoms during menopause. Menopause is when a female has not had a menstrual period in the last 12 months. This usually happens naturally between 45 and 55 years of age, but can happen younger. The average age is 51. 1 in 100 women will experience menopause before the age of 40. However, it can happen naturally much earlier, or as a result of surgery, serious illness, or medication. A transitional stage, known as perimenopause, can start several years before menopause. During this time, women have declining fertility and fluctuating hormone levels, causing symptoms such as hot flushes and mood swings. The chances of becoming pregnant during perimenopause are low, but not impossible. Contraception should be considered until menopause has been reached. At least a year has passed since the last period, or at least 2 years if under the age of 50. Menopause can cause a range of physical, psychological and emotional symptoms. Not all women will experience the same symptoms, but the most common are hot flushes affecting the face and neck, caused by the body's natural reaction to falling hormone levels. These sometimes result in red and flushed skin, usually lasting from 30 seconds to about 5 minutes. Night sweats, periods of heavy sweating associated with hot flushes which occur during sleep. Sleep disturbance. The female sex hormones estrogen and progesterone have an important role to play in facilitating sound sleep. Levels of estrogen fall and progesterone production ceases during menopause. Mood swings. These symptoms are not always due to hormonal changes. They may be related to stress and sleep deprivation. Some major life changes that often occur around the age of menopause, for example, death of elderly parents or children leaving home, can contribute to feeling irritable, anxious or worried. Headaches. Menopause may make migraines less severe if they were linked to the hormonal fluctuations of the menstrual cycle, or they may start for the first time, or worsen, around perimenopause because of new hormonal fluctuations. Weight gain. Many women put on a small amount of weight around the time of menopause, especially around the abdomen. This is not necessarily due to hormonal changes alone. Diet and reduced physical activity can play a big part. Other symptoms may include heavier and more irregular periods. During menopause, hormone levels may not follow a regular pattern of increase and decrease. As a result, irregular bleeding or spotting may occur. In some months, periods may be longer and heavier. Vaginal dryness. This may cause pain or discomfort during intercourse, as well as increasing the risk of developing a vaginal infection. A water-based lubricant or estrogen cream or tablet can be used to prevent dryness. Changes in libido. Libido may decrease, however, most women who enjoy an active sex life before menopause can continue to enjoy sex afterwards. Urinary symptoms. Problems with bladder control, a burning feeling when urinating, or increased urinary tract infections are common. Performing pelvic floor muscle exercises may help with bladder control. Hair loss or thinning. Women are protected from hair loss by estrogen. After the menopause, estrogen levels drop and hair loss or thinning can occur. Fortunately, this is temporary and may resolve itself. Hair loss can be gradual with age and can be owing to other causes. Disrupted sleep may contribute to short-term memory loss, the need to urinate frequently, aches and pains, dry skin and eyes, dizziness, tiredness and lack of energy. Symptoms may last from several months to several years. Some may disappear with time, others can continue throughout the postmenopausal years and require long-term treatment. Female workers experiencing the menopause may need specific considerations to facilitate their comfort. However, most adjustments can easily be made. Regular, informal conversations between a line manager and staff member will allow for early identification of possible adjustments to the working environment to ease the symptoms they are experiencing. For women who may find this to be a difficult conversation, the online resources that accompany this video can help. Some practical examples of changes could include providing training for staff and managers, raising awareness of menopause and acknowledging that it can present challenges for some women at work, robustly addressing negative attitudes which may add stress to work, facilitating discussions with female staff members about troublesome symptoms that may be affecting them at work, communicating with staff that health-related problems such as those experienced during the menopause are normal and providing signposts to sources of support. Consider flexible working hours or shift changes where possible. If sleep is disturbed, consideration of later start times where possible might be helpful. Review control of workplace temperature and ventilation where possible, and consider how they may be adapted to meet the needs of individuals. For example, providing a desktop fan or locating a workstation near an opening window or away from a heat source. Provide access to fresh drinking water in all work situations, including off-site venues. Ensure access to washroom facilities, toilets and showers where available. Where uniforms or personal protective equipment is compulsory, flexibility for managers is helpful. This may include the use of optional layers, as well as the provision of changing and shower facilities. Where work requires prolonged standing or sitting, provision of access to a restroom, for example, to sit during work breaks, as well as space to move about for women working in sedentary roles. Access to a quiet room may be useful for a short break to manage a severe hot flush. Severe menopausal symptoms and their consequences may combine to have a substantial adverse impact on individual staff members' normal day-to-day activities, potentially meeting the legal definition of a disability under the Disability Discrimination Act and the need to make reasonable adjustments. Further guidance should be available from human resources departments.